Hello, everybody. This is Greg Hills. Welcome to Leading and Learning in a Time of Crisis. I'm the co-CEO of FSG, and I'll be moderating today's discussion. I know that we have somewhere around 1,000 folks who have signed up for this webinar, so clearly something that's of interest to folks. So we appreciate you all joining, and we're looking forward to the conversation. Our panelists today are corporate philanthropy executives who will each talk about their company's response to COVID-19. We have three folks, Michael Stroik, who's the director of 3M Gives and vice president of the 3M Foundation. Hi, Michael. We have Lynette Bell, who's the president of the Truist Foundation. Truist is the bank that was formed after the merger of BB&T and SunTrust just last December. And we have Julie Gehrki, who's the vice president of philanthropy at Walmart. So welcome. Thank you all for taking some time to chat with us today. Really appreciate it. Before we jump into the actual the conversation, I wanted to share a few reflections and thoughts. Every day, I find myself using the word unprecedented. And it's certainly accurate in this context, but for some reason, it doesn't fully capture what's happening. And I reflected on this. You know, I turn 48 years old in a few weeks, and it's safe to say that in my 5 decades, this is the scariest time that I've lived in for this country and for our world. I'm scared for my mother. I'm scared for my wife and kids, for my friends, my extended family. I'm not sleeping well at night because I'm worried about and feel responsible for the livelihoods of 150 employees at FSG. But I know that those fears actually pale in comparison to what others are experiencing across the world. Over 3 million people lost jobs in a week. Many have already lost loved ones. Tens of thousands of people are sick. Our heroic healthcare workers are on the front lines of this crisis every day, risking their lives. And we have people working in stores who are still going to work so that people can buy groceries and get essential services. There are so many things that are unprecedented about this, but like I said, it just doesn't really capture it. This moment, it's gut-wrenching, and it's catastrophic in so many ways. So it's in that spirit of really thinking about a time where we don't have a roadmap for what to do. We're at a time where we've never been in this moment before, as individuals, as communities, and as companies, and as company leaders who are expected to actually help influence change. It's in that spirit that we're coming together to learn from each other, because each of us on this call is trying to identify what is it that we can do? What is the right way to act in this time? How do we want to think about ourselves when we look back 2 years from now, 5 years from now? What did we do in the COVID-19 crisis when things were unfolding in front of us? Companies clearly have a critical role to play in this. I wrote a blog a couple weeks ago called COVID-19 and Corporate Purpose, which is essentially providing some framing for what companies can think through on this. It's hard to believe that was about 2.5 weeks ago, because so much has happened in those last 2.5 weeks that I would write a completely different blog now. But I'm going to share the framing I use for that just to set this up, and it might be a little bit helpful for how we think about this. So I set out 4 ways that folks can think about this within companies. One is to leverage your core business assets, your manufacturing capabilities, your innovation and R&D, your relationships, your voice, your patient-centric services, et cetera. There's a range of things that companies bring that are part of their core competencies. Secondly, generosity still matters. The philanthropic support that companies can give is needed in communities. There's no question about that. Third, compassion versus costs. What kinds of decisions are we making, and do they always have a bottom line orientation, or are we thinking about the values that we hold dear within our company and with our culture as we think about our employees? And then the fourth one, which is a little bit longer term, is system problems require system solutions. And how do we think about the medium and long-term priorities that we have in thinking about what happened to get us to COVID and what a post-COVID world looks like. So I know that our panelists will hit on elements of each of these 4 areas. So I will step aside and let us hear from them. So I want to start with Michael. Michael, again, as I said, leads the philanthropy efforts for 3M. 3M, as folks know, make a number of things, including the what we now know as PPE, the personal protection equipment, which includes the N95 respirator mask that is in such high demand for our public health workers. We also know that Vice President Pence visited 3M on March 5th to talk about these masks on his way to Washington State. So lots going on inside of 3M. Michael, it'd be great for you to sort of take us inside the walls of 3M. What has been your response been like, both on the manufacturing side and the philanthropic side? And then what are some of those challenges that you all are facing as you sort through how to really act as quickly and decisively as you can in this moment?
Yeah, thanks a lot, Greg, and appreciate those poignant and powerful comments to start too. It's a really good frame for the overall environment we're in and the topics that we're talking about here today. But it's been obviously a wild ride for everybody on this. And at 3M, we've talked about this. We've been really working around the clock, focused on increasing the capacity of our manufacturing, focused on products that are vital in the healthcare industry. And thinking specifically where we've focused on and at discussions with the Vice President and everything around this is around the N95 respirators that are in such high demand right now. And we've doubled our rate of production since the start of this COVID-19 pandemic that we've seen. And so that doubling, and we're on our rate to produce more than 1 billion, actually I think it's 1.1 billion respirators annually within this time. And then over the next year, we're actually seeking ways and partnerships to actually double that again. And so that's been the huge amount of focus that we've had specifically at 3M. And I can share a little bit about how we did that and how we're moving forward, because I think it's an important story to tell. And a lot of this starts 20 years ago, right? In 2002, so almost 20 years ago, I was living in Singapore at the time and was able to see firsthand with the Sars outbreak what can happen to an environment when I was in Singapore, watching people with respirators out in public, people staying in homes and different elements. And obviously we never got to that level in other parts of the world like we're seeing right now. But we learned a lot at that time at 3M as well. We learned that, when we see the type of explosion in demand for respirators and other personal protective equipment in events like this, we didn't have necessarily the equipment or the ability to handle the type of explosion in demand. And so we've built what we call surge capacity. And what this is latent machinery that sits in our manufacturing facilities, ready to go when something happens like this. And so if you look back to January when it started going into the news, learning about what's happening in Wuhan, we actually activated here. So if you looked in our Aberdeen, South Dakota plant, we started having job fairs, internally, externally, hiring, filling out the plant, getting that latent manufacturing facility prepared, because we manufacture the lion's share of our respirators here in the United States in Aberdeen. And so it's interesting, as the philanthropy guy for the organization, we had just launched a new community giving program, right? So I'm reaching out to Aberdeen and saying, hey, you guys got to sign up, got to do all this. And the funny thing is they came out in droves. They were giving back to their community when they were facing this immense pressure to start really activating specifically on this. So for me, as I look back on that, seeing that commitment from our folks in Aberdeen was absolutely incredible. But activating that latent sort of manufacturing process and facility put us in a position where we've been able to double the amount of output that we've been able to manufacture specifically on that. But now, as I mentioned, we're thinking bigger. We want to think to the future as well in terms of thinking specifically about how can we continue that and double again in this next year. And that's going to take new types of partnerships, right? You talked about capability sets we have. We activate that advanced manufacturing capability set we have to 3M, but now we're building new types of partnerships. Just last week, we announced a partnership with Ford Motor Company, right? Using parts from Ford, literally fans from their F-150 trucks, right? Aligned specifically with 3M materials as well to build these air purifying respirators. So it's powered air purifying respirators that are allowing us to reach healthcare industries more directly as well. And so what I'll close by saying is that just from a manufacturing standpoint, one of the challenges we faced as well was that overall, we serve an industrial network of suppliers within this space, right? So if you're building a home, we have respirators that would be used in those spaces, in those industries overall. And government relations has been a big part of our response thus far when we think about how we're investing and ensuring that our products are getting in the hands of people who really need them, in particular our healthcare workers. I would note the federal government here in the United States, updated and passed the PrEP Act and expanded the use of our industrial level respirators to be serving healthcare populations as well. And so if you think of this as that industrial business is in our safety and an industrial business group. It's not even a part of our healthcare business group. But now 90% of those healthcare products, of those those respirators themselves, are actually going to healthcare workers and to support public health overall. So that's been a tremendous shift for us and a huge part of how we've helped reach and improve lives in those ways.
Great, thank you, Michael. And it's great to hear those different perspectives about, looking back 10 years ago or 20 years ago, I think you said, and the thinking about additional surge capacity, as well as sort of some of the unique partnerships you've got for production of respirators with Ford. Let's turn to Lynette. Lynette is, again, the president of the Truist Foundation. So Lynette, you lead a foundation for a large bank whose consumer and commercial customers are facing real financial hardships in this crisis. You launched the Truist Cares initiative, I think within the last couple of weeks, that committed about $25 million. So you moved quickly to launch this. How did you do it? What were some of the components of the initiative that you've already established? And then also, what changes to your business practices is Truist considering in this context? I think you're muted, Lynette. Oh, wait.
Good afternoon. That's better, I'm sure.
Yeah, good.
Thank you so much, Greg. And Michael made a very important point that innovation takes time. And when you have critical issues like a pandemic that's entering your country, being responsive to that is very, very crucial. And so, as you're right, we're a bank foundation, and what did we do to address the pandemic? As we got news of this, executive leaders were really adamant that we needed to jump on this in a real important and impactful way. And so we created strategically Truist Cares to address not only how can we support our clients, our communities, but also our employees or our teammates, as we like to call them. And so we came up with inspiring continuity, clarity, and care across those three bands of community, clients, and teammates. And so Basic Needs for Better Days is the program that we created by investing $25 million. We created a three-phase approach to this process as we looked at the strategy, and there were multiple areas of the company that came together to help the strategy. But we knew that this was critical, and we had to get it out there in a very quick and efficient manner. So inspiring clarity and continuity and care for our employees and our clients and our communities was phase one. And in that phase, we made the initial decision to invest directly into the CDC Foundation, as well as into Johns Hopkins Medical Foundation, so that we can talk about how do we address data sets that say, how is the pandemic spreading and what is needed immediately? And so having that responsiveness is really critical. Phase two was about being thoughtful and bold in our response to emerging basic needs across the spectrum, both local and regionalized. Phase one was more of a national approach, and that we looked at those two big facilities to sponsor. But phase three was about how do we get it on the ground to organizations and communities. Phase three is building back better. How do we do restoration and resiliency for those nonprofits in our communities? So that was the three critical components of how do we address this pandemic in a very responsive way. So the other piece that I want to talk about really quickly, under phase one, we announced the two large CDCs as well as United Way Worldwide. Again, trying to use impactful data versus being episodic in our response. We know that United Way 211 had spikes immediately in New York City and in the Seattle, Washington, where they had the first kind of real outbreaks of the pandemic. And so working with those two large organizations to say, how do we supply that basic need and help our communities, clients, and consumers sustain themselves during this critical time was what we utilized. The other piece was, how do we help our employees? So during the pandemic, we have a one team fund at Truist Financial Corp. For every dollar that an employee invests that addresses hardships, disaster, a pandemic, our foundation provides a $4 match. And so right now, we're actually matching a 4-to-1 for employees in this one team fund from the Truist Foundation. So if I can go into phase 2 a little bit under Truist Cares, that thoughtful, meaningful response to emerging basic needs, we had a 5-part program under this Truist Cares initiative. It was called, so we broke it down into Truist Cares for Youth, again, looking at how do we support teens now and students that are now sheltered at home in a real impactful way. Students who are on free and reduced lunches, how do we support organizations that would provide that really basic need of food? How do we support making sure that they are able to access lesson plans through a broadband network? The second component was Truist Cares for Seniors. This was strictly about providing medical response or medical supplies to seniors, as well as food distribution. Because once you shutter down in a home, it's hard for seniors to get out in that process. The third one, really important, and our leaders were very emphatic about this, is Truist Cares for Small Business. How do small businesses have to now shutter their doors because of the pandemic survive and not have to shut down? We created a grant program that actually, through our foundation, will support businesses, small to micro-sized businesses, with a grant to help them during this time period that they could apply to. And we actually utilized 2 intermediary nonprofits to help us with that process. One was the National Capital Investment Fund, and the other ones were the Low Income Investment Fund. Both of them got $1 million each to help small businesses to provide that grant support that they would need. And then finally, Truist Cares for Workers. We know that the pandemic causes a huge disruption as businesses had to close their doors during this time period to make sure that not only are families safe, but employees are safe. And so we actually went, again, using data sets because, again, how do we identify the needs in our marketplaces, in our communities? So Johns Hopkins, as I stated earlier, was part of phase 1. We used a lot of the data that Johns Hopkins provides, looking at where is the pandemic growing? What is the real immediate need for the pandemic across the country? And so we used that data set. The second component was how do we use United Way 211 that provides direct help through their nonprofit organizations for rental assistance, utility expense, and even food. And so we use those 2 data sets through those organizations to help identify where do we distribute our dollars from our foundation and charitable fund to support this pandemic. I would say that when we looked at this across the company, we talked about a local and regionalized approach. I'll give 3 examples of what we've done under the Truist Cares initiative that we're really proud of. The first one is looking at, we have plenty of applications on a daily basis since we made the announcement on March 18th. Every night, talking about the challenges of a pandemic, every night we have a small cohort of employees that are looking at grant applications as they come into our online process nightly so that we're immediately responding and getting dollars back out in the marketplace. We have tons of requests from food distribution centers, community foundations. One that was really important was the Capital Food Bank out of Washington, D.C. They directly provide food and support to first responders. But on top of that, they use data from the first responders to say, hey, where's the hardest impact neighborhoods that are on a granular level that we wouldn't get from some of the data sets that they said that's who needs that help right now, needs that type of support. So they provide not only us providing and distributing food through them, but also how do we use their data set to help identify what neighborhoods are most impactful. The second one is in hospitals. We've got a lot of requests from nonprofit hospitals across the nation. In Georgia, because we have a lot of rural and large urban markets in our footprint as an institution, we know that rural markets sometimes get left out of this continuum because of their size. So we just provided a large grant to B.B. Putnam Hospital. They were on ABC News because they were using surgical sheets to kind of provide coverage for the masks that they have. And so we provided a grant to help them with their medical supplies. Really proud of that because in Albany, Georgia, a small rural area, is the third largest pandemic outbreak in the state of Georgia. So being able to look at data to help respond to episodic challenges is critical to the foundation because we want to be thoughtful, impactful in our giving going forward.
Great, Lynette, thank you so much for that. And it's what a wonderful sort of portfolio of things that you've done in the Truist Cares approach, thinking about national, thinking about regional, local, different segments of folks that you're benefiting, the use of data to target where the needs are. So a really impressive set of things that you've done in less than 2 weeks. It's amazing. So let's now turn to Julie. Julie, as a reminder, is the VP of Philanthropy at Walmart. As folks know, Walmart is, I believe, the largest private sector employer in the world, employing over 2 million people. So anything that you do, Julie, is at a massive scale. So a couple things I'd love for you to touch on. I know you have a robust disaster response approach with a nice framework. How does your COVID-19 response differ from your response to other disasters? And then, an obvious area of interest that folks will have is sort of the how you're supporting your associates who are on the front line of this crisis. What changes are you making to support them in your stores as this is evolving?
Sure. First, thanks for doing this. I think I've been over here scribbling notes. This is all happening so fast. I think we're all hungry to connect and learn from each other. So it's great to spend a little bit of time together today. You're right, Greg. Disaster philanthropy is something we've been doing for years. When I joined the company, the story of how the company worked in Katrina is really a moment in which Walmart talks about a modern creation of shared value, of really thinking about how we use our supply chain to solve problems, of how we lean into our strengths. And since that time, we really have built a muscle around disaster response. We have an emergency operations center. We have protocols for how we touch base every day, how information is shared, all of these things that very much are critical at this moment. But all of that has been built on the past idea that it surges in one geographic area. And you're able to take kind of latent capacity from other places to get products into that region, or staffing, or all of these things. And clearly, as we look at, the last several months around the world, because we also operate retail in China, that's not how this works. The surge is often everywhere, and you're responding globally. And so some of what, we've done over the years, we just don't have the same assets, or frankly, those assets are being used just in the marketplace. Keeping things in stock is clearly a core part of what we need to do at this moment. But there are other things about the model that make a ton of sense. So it is all structured around stakeholders and thinking about each stakeholder we serve, starting with our associates. So I'll talk a little bit about the frame and then run through it. But it's associates, customers and operations, suppliers and communities. And each meeting is structured in a way that allows us to walk through that and really make sure we're meeting the needs and thinking about those stakeholders at every piece. And it does start with associates. So we were able to institute an emergency leave policy that changed how absences worked, changed how leaves worked really over a weekend a couple of weeks ago, and rolled that out so that associates really could, if they weren't feeling well, if they didn't feel comfortable, not come to work and not be punished. We've made bonus payments of are making bonus payments of over $550 million so that associates, both part-time and full-time, have cash in hand to meet the needs. We've changed our healthcare so that they have free access to telemedicine. All of these things are just constantly, and that's a lot of listening. It's a lot of being really connected to the employee base as to what's not working, staying really close to the CDC on the guidelines they have for safe workplaces, so that we are really leaning into everything we can do. When it comes to customers, that is staying in stock. We sell vital things that people still need in their everyday, and really are being tested on that. The growth of, we're grateful that we've been building an omni-channel model. So using physical presence and online ordering in this blended model has been really critical. So that grocery pickup and these kinds of things that allow you to serve at scale without people coming into a store certainly have been growing over the years, but this is the moment that we're seeing that it's always been growing, but the demand is higher than ever. We also changed hours. We closed overnight so that we could do a deep cleaning every night and change practices around that to make sure that it's a safe environment. And that is something where we're continuing to learn. We're installing plexiglass in front of registers and prescription pharmacists. We're putting decals on the floor so that people practice good social distancing. We've instituted hours for seniors to shop. Really, it's everyday problem solving and thinking about what are we learning and how could we change in order to make it stronger and better. When it comes to our suppliers, what is, I think, many people don't know is we have about 18,000 suppliers, and close to 2/3 of those are small to medium enterprises. And so figuring out how we can expand what we've had in place, a supply chain financing program that allows them to get paid very quickly so that they have cash flow and all the operating they need. Also, we have close to 10,000 leased spaces in the front of stores. So we've waived rent for April for those spaces. So thinking again about all of the ways we interact with our stakeholders. And then the fourth piece, communities. That is both the business and philanthropy. And it's everything from hiring. We announced last week that we wanted to hire 150,000 additional employees. Those are both full, part-time, temporary, long-term. People need different things at this point. In that we totally rewired our hiring process so it would be faster and more efficient. We actually have hired 25,000 people in a week. So wouldn't have, in the past, it almost took us a week to hire. And so really rewiring things as we're going. We have started on testing sites in parking lots and are using parking lots for interesting community connections across the country as appropriate. And then also have $25 million that we're investing philanthropically around the world. That's for a number of things, but one of the large pieces is we have a long-term commitment to food security. And so work we're doing in the U.S. With suppliers and our own philanthropy to help Meals on Wheels, Feeding America, thinking about the problems in the populations that are specifically needed at this time and making sure we get money in the hands of people who are ready to deploy and are out there on the front lines already. Additionally, we have a spring campaign to raise money for Feeding America called Fight Hunger, Spark Change with about 18 suppliers. We turned on fundraising early, recognizing this was a moment in time people were really looking for ways to help. All of that we really think of as kind of phase one. And I loved how Lynette talked about these phases. That's very much how we're thinking. This is about immediate need. This is about working with people who are up, ready to deploy, have a plan, get money in hands kind of tomorrow. And it's iterative. And we're learning every day. As you think about, we transition to phase two, we're thinking about how do we unrestrict our grants? What are the ways we're going to support NGOs in our space in the long term? If the first phase was probably about human need and most kind of basic, we're starting to see what we think will be a second wave of structural and system challenges that we want to balance with long term. We have commitments that aren't going to go away on things like climate. We need to stay committed there, but also we can look at solving problems in different ways because of what's going on.
Hey, Julie, thank you. No, it's a wonderful rundown of all the different things according to that disaster response framework and the different stakeholders and what you're able to do across the business. I want to, this is a great sort of introduction from each of you and everything you're doing. I'm channeling the folks who are probably joining here and listening for a lot of the sort of how you do this, in the sense of you're likely navigating a lot of challenging internal decision-making processes that are happening in real time. You've got pressure from the C-suite. You've got pressure from your HR executives. You've got pressure from government relations who want to be responsive. You've got a range of organizational immediate pressures, and you want to just really help people in this moment, the human element of it. Maybe take us inside sort of how that's unfolding. How have you navigated that? You wear one hat in an organization, you don't have the full power, yet you are looked to bring a lot of the resources of the company to bear on this. What are some lessons that you can share with folks who are listening who want to learn and benefit from some of the experiences you've had?
Sure, I can start. I think we're really lucky in that we did have this emergency operations process, and we do have pretty strong cross-functional teams. So, I have a daily call with a cross-function of leadership where we run through the day, we make decisions, we weigh in literally every day. But I think even in that, there is a lot of assuming good intent and making the decision that crosses your plate. We can't always socialize in all the ways we'd want to. There's kind of a legendary story from Katrina that the CEO at the time said, New Orleans won't be able to run everything through Bentonville. We're going to have to trust people on their ground to make right decisions and use good judgment and know that kind of the true north is doing the right thing in this moment. And I think that principle remains. We won't always get it right, but we're trying really hard. We're going to learn. There are a lot of people who don't spend their lives in foundations or kind of social change, needing to use those muscles and making sure you're thinking in a way of really understanding how much more we can do if we're all working on it, rather than, hey, that's my lane and that's our job. So, it really is making sure we're using everybody's capacity to help, not kind of staying just as, oh, this is the team that does social impact and environmental impact work. We all do. And Walmart's had that principle that is part of everybody's job for a long time. These are the moments where you really lean on that.
Yeah, thank you. I like that. Assuming good intent, using good judgment, stripping away some of the bureaucracy, it sounds like, is important. Lynette, Michael, anything you wanted to add to that?
Yeah, I'll add that one of the things I think Julie made a very good point is about framework. For us, it was about creating the right discipline. Clearly, we have had natural disasters happen to every company, but being able to respond in a very cohesive and quick way was intentional on our part. And so we pulled together, as Julie said, socialization has to happen. But I will say the C-suite was like, get activated now and pull in all the multiple components that exist in a large organization to get it done. And so, yes, that means working on weekends to come up with strategic framework, but by having buy-in from functional partners as well as business partners was critical to that. I apologize, that's my mom's phone. So that was critical to that business function. So we had buy-in right away and had that influence going inside of the organization so that we agreed that investment was going to be part of it, that how do we activate our employees, our teammates to get engaged, and how do we activate not only what do we do for compliance, like what are going to be some of the payment assistance that happens in the company, what happens from a human resource perspective that is critical that we ensure that employees get the time off when schools have shuttered and closed without using vacation. How do we actually provide support to them for a prepaid bonus during this very pandemic and difficult time? And so looking at all multiple areas of our bank to say, what needs to be activated? We were like, everything has to be activated.
I would echo a lot of what Lynette and Julie are mentioning about this sort of company connections and engagement that we need in times like this. And it's been interesting, the types of challenges that have arisen that have required us all stepping up from different areas, including our area within community relations. I think of, working with our personal safety division with the ramp up in manufacturing respirators. We were prepared to get to this 1.1 billion because of the steps we took before, but then determining where and how you allocate those is an extremely difficult job in and of itself. And so I'm just really proud of of that business. We call them PSD. They prioritize healthcare workers tremendously within this space. And I mentioned, I think earlier, that 90% of all of our respirators are going to the healthcare industry. But we've had to leverage public-private partnerships in new ways, right, to get these supplies out to the most heavily affected parts of the country. I think here in the U.S., engagement with FEMA, right? You mentioned the vice president coming to our headquarters markets a few weeks ago, and thinking about how we leverage these types of partnerships and relationships to inform how we ensure that we get these life-saving products in the hands of people who really need them most. Part of doing this is also, as we think about the donations we make and the partnerships that we have with groups like Direct Relief, American Red Cross, MAP International. These are incredible NGO leaders, not only here in the U.S., but across the world. I was on a call just a day ago with Tom Rohn, who's our contact from Direct Relief, and the work that they're doing with free and charitable clinics, ensuring sort of this equitable outreach into communities who have been marginalized in these spaces, is absolutely incredible. And so I would recognize many of our partners as informing how we look at this in the future, or looking at this now and in the future. And as we think of the product donations, in a given year, we typically donate as much, if not more, in product donations as we do in cash. Many times, often these respirators that are used in different types of disasters and humanitarian aid projects. And, one interesting challenge we've faced related to that is, we rely on our partners like Direct Relief to get those products in the hands of people who are going to use them. What we've seen is actually a lot of issues and a lot of publicity around counterfeiting, around price gouging as it relates to respirators in these different spaces. And, Greg, in your opening comments, you talked about values within your company. One of the things that I was really excited to see as a part of our commitment is that we didn't increase the price of our respirators 1 cent, and we've committed that we won't in the future. And that's an interesting value that is really important to us as we see demand just skyrocketing across the world on this. But in many ways, we have to think about our value chain as well. We think about those distributors who we're working with, that we lose control about what's being charged for respirators as well. And so we've made public offerings to the Attorney General of the United States, to different governors associations, really offering up our help to think about how can we help address these issues around price gouging, around counterfeiting and different elements on there. And so the last thing I'll say is, just because, it's about these challenges, is that you see so much in the media as well, and it's about 3M Company, and some of it's good, some of it's bad, right? As it always kind of goes that way. And I will say, we're a company of a bunch of humans, right? Like, we're all working together, we're talking to each other every day, and we see that stuff, and I know it's hard in some cases, and sometimes it's really great too. But I think, what I would say to you all and the folks that we have on the call is that, we at 3M, we're really focused on stepping up, and we'll continue to step up to protect our people. And at the end of the day, we feel like with these products that we have access to, if we give it our all, we're going to save a lot of lives. And so that's brought me a lot of great feeling in terms of the commitment that we're providing and the engagement we've had with our communities.
Yeah, thank you, Michael. I wanted to build on one point that you made, which is when you talked about the work with Direct Relief, and you're trying to ensure that you have equitable outreach to people. And we know that in our sort of normal course of social change efforts, often folks are looking to address the inequities that are in place as a result of, sort of centuries of structural, institutional barriers that have been created, particularly for people of color. When we think about the response to a crisis like this, and how this is going to treat people who are historically marginalized, how do we act such that we can try to prevent this crisis from further exacerbating those inequities? So I guess the question is, to what extent and how have you all been able to sort of think about an equity, racial equity lens as you're thinking about solutions in this moment and for the longer term?
I think this is a place where we're trying to build off really a commitment to do that every day. And the more you have that muscle already built, and that commitment as part of how you work, the better off you'll be. And so we have that in our grant making every day. We have that as Walmart is an access employer, an access, a belief that everybody deserves access to high quality goods at low cost. And we've seen it come through in our grant making, whether it is finding locally that one of the gaps for the medical hotline was translation and making sure that that was put in place very quickly, whether it's really embedding that in our question with every NGO. How are you thinking about equity? How can this grant advance that work? Making sure, if you were thinking about our grants in food security, it was very intentional to think about Unidos and the outreach they will do, along with Meals on Wheels, who are the populations who we think could be further left behind or particularly vulnerable in this moment, and how do we support organizations who have deep relationships and expertise there. And so it's got to be embedded in everything, whether it's with an organization that exists for that reason or within an organization that serves everyone. How are they thinking about it? The question that while many of them teach us every day, we also know that funders asking that question and being intentional about putting money against it can help them accelerate the work too.
Thank you, Julie.
I love the way, Julie, that you talk about that, building that muscle, right? That resonates with how we think about this approach to equity within 3M Gives and the approach that we're taking to our community engagement and our overall corporate response to the work we have in here. Likewise, with this and with all of our work, one of the things that we often talk about is how are we lifting up and incorporating more of a community voice in the decision making when making grants and when investing and making decisions about how we're going to engage in our community. Our number one focus area is around STEM education, right? STEM and skilled trades and our engagement in there. And we have a lot of conversations internally about understanding how we lift up that voice. If we're going to be supporting folks who have been marginalized, for me, a part of my personal journey is understanding that I could never understand what it feels like to be marginalized within STEM. And a part of that is for us lifting up this idea that lived experiences are very important and are critical to the decision-making process as we think about those inputs to the decisions that we're going to be making. And so applying that in this lens, and Greg, you had talked about that engagement with direct relief, is relying on them. We haven't invested in health. Health isn't a major focus area for us from a grant-making standpoint and from a skills-based service engagement. I mean, this hasn't been that core focus area for us. So relying on those partners and their partners on a local level to learn and to grow, and always saying, if we don't know all the answers when it comes to this. And so that's why I like that metaphor for flexing the muscle around this and building the muscle. And Lynette, you talked about data in a lot of your first response. That's something that we're always trying to incorporate more data, and that data is where you can sort of unpack some of these equity challenges. And then Greg, I just want to call out too, the partnership you all have with PolicyLink, I think is really inspiring. Some of the research and reports that you guys have put out. Michael McAfee is some kind of leader, and so are you. And so I think the joint forces of those types of organizations and you guys providing input on that has really helped us as we think about our journey in this space.
Yeah, I would echo all both sentiments from that. I think one of the things that was critical for us as we looked at yes, we were looking at data for impact analysis, but I think it also was looking at where are the opportunities, even during this pandemic, to create synergies with organizations, right? Particularly with nonprofit organizations. So a lot of the requests that we got in, as I talked about United Way earlier, not that I'm their commercial today, but they were partnering with the community foundations around the country. Seattle did the first model of this about using the Community Foundation and United Way to join partnership with, so that they could be the philanthropic conduit to address needs from housing to food to medical supplies. And so as we had the pandemic unroll, there were plenty of organizations that created synergy to do the better application so that they knew, based on the hotspot that they sat in currently, that they had multiple needs that needed to be addressed in a very responsive manner. And it sounds like from both organizations, 3M and Walmart, that responsiveness is key to this framework. And so we wanted to make sure we pull that into our framework of being responsive, but also creating the right synergies to drive that concentrated impact around our business model.
Great, those are helpful perspectives, and I knew that each one of you is thinking deeply about this, and it's so both critical and difficult to do as things are unfolding quickly. So we're getting a bunch of questions coming in here from the participants, and I want to see if we can throw some of these out here. I might throw out a couple, and then sort of maybe can do a little bit more efficiently in terms of jumping on them. So one of them was asking about, can we use the templates developed responding to the pandemic for preparation for the next one? We were caught off guard in this one. What frameworks can we develop to prepare for future ones? So that's one. A second one was asking about approaching communications, which obviously intersects with your roles in a significant way. Obviously, even what we're doing today is an element of this. Some audience members are in Latin America where there's hostility toward the private sector. Companies don't want to be seen as patting themselves on the back. How do you thread the needle in the communicating the good work that you're doing without generating some skepticism there? And then the third one, how are you all thinking about partnering collaboratively with other funders, including government, in thinking about problem solving? So those are some good ones. I'll sort of open it up to whoever wants to sort of jump on one or several of them.
Well, from the bank's perspective, one of the things that we'll say is that we have clients that cross every industry spectrum, and so we're looking at how do we create the right energy and synergies with those organizations to address critical needs. And so we're not a global brand, so we don't have the international issue, but we do look at nationally where organizations that we can partner with that will help address a very critical need in real time. And so that has been part of kind of lessons learned here, is that be responsive in a real way. Look at where our clients are providing, whether they're manufacturing or in healthcare. How do we help assist them to address the critical needs that's facing our country? And use the resources that we have, whether it's philanthropic giving or even charitable, to kind of draw the circle around it to make sure that we build a model so that the model actually works, and so that we can use that as a lesson learned to go forward. But evolution of this has to be part of the critical function, that it has to evolve every day. It has to change every day, but there's some rails that we can place around it to stand it up. And so understanding the client's needs, understanding what the client produces, and understanding where do we intersect so that we can help be responsive to the need at that time.
Thank you, Lynette.
I'll chime in. I'm going to try to hit on the first and the third, I think, a little bit together in terms of my response on this. That in terms of thinking about the future, right, and the template idea, one of the things I've been struck by is this influx of demand of collaboration, particularly from other companies, right? Hearing from other companies contacting us and saying, hey, how can we help around this respirator issue? What can we do within this space? And that's a really interesting, I'm used to hearing from the social sector about different collaborative sort of processes that are out there. And I think that's informing me how I think once the dust settles on this and we think of our future, is how we prepare better for the future is breaking down any barriers we might have for that cross-sector collaboration. I mentioned the partnership with Ford Company in terms of building those air-powered air purifying respirators. And that's been a really interesting and a big win for us in terms of thinking about the capability sets that we have around advanced manufacturing and in certain areas around healthcare and in industrial, and how we apply those. We typically think about how do we apply that internal at 3M, all these different technology platforms that we work with. But thinking about how you couple that with the capability sets of other companies around the world is really powerful. And when I think of the future on this, when I think of of the purpose behind companies like Truist and Walmart and everything that's happening out there is that, 5 years ago, I think you'd be hard pressed to find two competitors coming together to get past their competition and seek for the common good. And I like to think that could become the norm. I think that could be a huge part of future corporate social responsibility is how do we break down those barriers and collaborate and partner in the future.
I agree with both Michael and Lynette. Hitting these really quickly, I do think the template we're using is holding up for the most part. I just think we've got capacity to build. Part of what we're really thinking about is what is this revealed about the system, and what resiliency do we need to build in the system so that we aren't quite in the exact same spot we are. And that template would certainly serve us all better if the system were stronger. On communications, I think this is one of the most important parts of this moment. We are all hungry for authoritative communications, for clear. It's easy to get confused. I'm lucky I work with a world-class communications team who is thinking about how we get messages out to all stakeholders, frontline associates, leadership, interested parties on a constant basis. And that's everything from video, social media. I mean, it is multidimensional, it is every day. And it recognizes that things are evolving. And so it is constantly iterating on what we know and what we can put in place. And so, that is, I think it's really important, particularly with internal, that is our senior leaders being on camera, talking directly and honestly and being vulnerable about what they're learning and feeling, and all of those things is really important. And then the internal communications of constant check bases so that information is flowing, so we all have the information we need to make good situational decisions. It just is, it's the lifeblood of how we operate in this way. When it comes to the work in LATAM, I think it's a really good point. We operate in Mexico, Central America, Chile, and Argentina, and I've been in touch with all my colleagues across the region, and it is different. But I think there's an underlying lesson that's true, that you can't build corporate trust in these moments. It's really a reflection of the partnerships, the day-to-day relationships you already have in place. And we see this, we've seen civil unrest where stores that have really great community relationships are saved by the community. All of these things, I think these moments reveal true nature. They don't necessarily build it. So, it's on all of us to show up this way every day, not just in a crisis. And I think that's certainly true in LATAM as well. It's also being pretty humble about what we can and cannot do, which gets to partnerships. This takes all the sectors. Corporate sector has a huge role we need to play, but just as much as everybody else. And so if we are pretending we can do this all, it's just totally false. It's a process that's taking a lot of humility to learn from others, to think about things in different ways, to say we didn't quite get that right, and to learn what we can do better.
Yeah, thank you for those reflections. Maybe the last area I'd love to probe on, it comes back to some of the thinking that we've had in some of the writing we've done around creating shared value. And one of the core tenets of that, those ideas is that the health of business often relies on the health of society, and that you, as a company, are only as effective as the sort of effectiveness of the infrastructure and ecosystem in which you operate. And one thing that we've obviously observed in this crisis is that there's been a woeful underinvestment in the public health infrastructure of this country, whether it's CDC or whether it's state or municipal public health departments and capacity and preparedness for this kind of crisis. And that has come back to affect companies in really material ways. So I guess the question I have is, to what extent going forward do you think your companies will be more not only attuned to that as a sort of priority for your own competitiveness, but also active in using your voice to advocate for investments that will enable our communities and the ecosystems in which we operate to be stronger and more resilient to future crises like this?
I think we're all learning, but I'm grateful to work at a company that does think long term, that does have, when we boil our corporate strategy down to a page, shared value is, Greg, you've seen this, it's kind of a pyramid and it says, here's what we do. And we do all of this to create shared value for multiple stakeholders in the long term. And so with that principle, I think you're always thinking about system health because you do recognize that we have the ability to reshape systems and to be a part of that. I think that that will manifest itself in hopefully new forms of partnerships. Walmart's been experimenting in the healthcare, particularly for people who might be not getting what they need out of the formal system for a while with clinics and other things. I think that really thinking about how we can work across sectors to build a stronger system for the future is top of mind. But to pretend that we have the answers at this point is probably also unrealistic.
Yeah.
I think for us, the continuity and clarity that has to happen for our industry is going to be critical for, supporting other industries, whether public or private. And so you talked about the deficiency in our healthcare system. Clearly, we've seen that even through this pandemic because nonprofit hospitals around the country have made applications to get additional funding for medical supplies. And so not having a full assessment for what's coming down the lane, somebody asked me earlier, like if you had a wish and you could click your heels 3 times, what would you wish for? I would wish for a vaccine, of course. But more importantly, Bill Gates did a TED Talk 4 years ago about the next big war was on a pandemic and putting the infrastructure and rails in place to have the framework to support the needs that are going to arise from a pandemic is critical. And so when we look at Truist Financial Corporation, we're a new entity coming into the marketplace. We just merged. And as part of that merger, we have tons of ecosystems that we're interlocking together. So having a full assessment of what we own today and what we have responsibility for, but how do we branch that out to grow, to address things that we can't see that are going to happen? So I hope we get some great lessons learned from all of the components inside of our organization that came together to build the framework to support this pandemic. But how do we get prepared in front of something like this in the future? That's what we need to learn.
Yeah, thank you, Lynette. Michael, 30, 45 seconds or so for the last word.
Yeah, I'll just close by saying, I think we've learned that as we grow in this space and we think of the voice that we have access to, it's kind of growing in unexpected ways. I talked about the price gouging and everything out there, and we've made our commitment that we're not going to increase our prices and all of these different elements, but it's also, who we sell to, how that's being used out there, that value chain of that overall. And we're learning our voice matters and has great influence in terms of thinking about how we can play a role in supporting major issues that are extremely important.
Great. Well, I see we're sort of a couple minutes away from the end of our time. A couple themes that I've just sort of ticked off here that I've heard here, which I think are just wonderful things for us, all the listeners to take with them back to their companies and their organizations that are thinking about how to navigate this difficult time. One, I love the point about assuming good intentions, trusting your people to make good decisions, segmentation of your stakeholders. We're really thinking about a framework where, okay, what are the folks we're looking to address? What are their different needs and how do we drill down on those? This notion of listening to your associates to sort of see what their needs are in the stores, listening to your small businesses, listening to your nonprofits, listening to the CDC. This notion of lived experience and equity and really understanding how you can reduce the inequities as we're addressing some of these challenges. The notion of collaboration and cross-sector efforts and seeing that in unusual and unexpected ways is a real promising development. This notion of trust, that you can't build trust immediately. It needs to be built over time. You need to do that through humility. And then lastly, Michael's point, voice matters. and that you all have a voice, and that is really important. So I just want to thank the panelists, Michael, Lynette, and Julie. Really, really appreciate your time, your insights, your wisdom, your vulnerability. This is tremendously helpful for everybody who's going through this. So thank you for taking time out of what just must be a really amazingly busy time for each of you. And thank you to all of the participants for listening in. As next steps, we'll be sending the meeting recording out for folks. So if you register, you'll get the recording. We'll have a quick survey. So we'd love the feedback on the webinar and to gauge interest in sort of further webinars we might do on COVID-19. So with that, I will close us out. Thank you so much. And everybody stay safe.
Thank you.
Thank you.